Here's another lawyer, also trained in. It's turning out to be a lawyer day.
Angie was a lot smarter than me, though. I practiced for 14 years. She knew to get out sooner.
To realize that that's not what you wanted to do. So,
Thank you, Angie. Thank you, Shawn. Thank you.
Thank you so much. Take care, everybody. Bye-bye.
Erode any further time of yours, Shawn, and I'll let you get right into it.
Okay, I'm hitting share screen. What's going on here now? Share. Let's see what's going to happen. Are you seeing anything of mine?
Yep, your desktop.
Okay, so does it look like you're seeing my slides now? Have you got an ugly picture of me?
I can see your slide now. That's an amazing picture.
Well, thank you very much, Abbas. Angie, wow, that was a great presentation, and thanks for the very kind lead in and introduction there. That's a hard act to follow in that sense. So the table's been set. My name is Shawn Peers, and I'm the president of Dental Peers. Along with doing some coaching and consulting, I operate a buying group for dentists as well, for dentists in private practice. The focus with respect to that is to be able to help dentists in many different facets, to be able to help them through coaching and consulting on the top line of revenue production and patient care, but also to be able to help on the bottom line, to give them some of the cost advantages that the larger corporate DSOs would be only able to get for themselves. And here I give them an opportunity to compete with them on sort of a level playing field, but at the same time to try to be able to do it in a way that allows them to protect their independence, and they still get to be the boss. If that's important to them, that's what I'm here for. So if you're wondering, that is in fact what I look like through the benefit of a professional photographer with lighting and camera angles. Abbas knows a lot more about those sort of things than I do, and how much you can even make me look good. So I can't promise I'll look as good in person as I will on that. I know we wish we could all be together in person. Someday we will again. I have to salute all of you for being here. I have to salute Abbas and his team for putting this together. This is also a big accomplishment to try to be able to pull off online, not an easy task. And for all of you for being here for it. So I appreciate your patience and your being here. And I know on so many levels, this is the moment you've been waiting for, right? When you looked at the scheduler, you thought, yes, I do want to have some information on, on things like the legal implications and my partnership and associate agreements. And I want to know a little bit about practice purchases and looking after my finances. But boy, the thing I was really looking forward to was the talk on effective meetings. And as I like to call it, bringing the order to meeting. Now, I'm sort of being a little bit sarcastic and tongue-in-cheek, because I'm sure some of you are kind of thinking that, wow, this sounds like a dull mechanical topic. But it's actually interesting in the sense that not only the topic is so important to your top line production, but putting us together, Abbas, myself, and Angie on that front, because what Angie had to say to all of you was absolute gold. And I really hope that everyone takes a lot of the information that she provided and finds a way to be able to incorporate some of that into your day-to-day practice when the day comes. I also approach it from the standpoint of the importance of communication, but also from making sure that the team as a whole is on board, because that is what effective team meetings are about. It is about making sure that we bring the team together. And the reality of the situation is, and probably a big reason as to why you're thinking, why are we having a presentation just on how to conduct an effective meeting? Everybody complains about team meetings. It's just a reality of life. When is the last time that you scheduled a meeting and somebody went, yes, we're having a meeting? It's not a common occurrence, right? People complain about meetings. And what are the reasons that they complain? Oh, is this meeting really necessary? Do we really have to have this meeting? You've sort of just thrown it on them, maybe about 2 days warning. they've got other things scheduled already that they would have rather done. Maybe it's, that time in May when we get to really saying goodbye to winter and saying hello to those warmer days. And we're just thinking, for that hour of I could get away from the office and just go out and see the sun and relax. And now you're going to keep me in here. Do we really have to have this meeting? Huh. And the other thing you hear is, even amongst some people that do see value in meetings in general, is maybe they don't see value in your meetings. And they just sort of think, we meet, we talk. I don't know what's being said. We talk and we talk and we talk some more. And at the end of the day, nothing changes, nothing gets done. We still have all the same problems we had before. These meetings are not effective. Why is this important? Well, here is the key, okay? We need to make the meetings more effective. It is absolutely vital, because I can tell you, as a coach, as a consultant, as someone who's walked into many offices where they are struggling, where the team is recognizing that they are underperforming, where patient care isn't up to the standard because case acceptance isn't as high as it should be, or there's too much open time because they're not effective at scheduling the next hygiene maintenance appointment. And so patients wind up overdue, and their perio problems get worse. All those sort of things can wind up going on. And they tend to be bigger problems in teams that don't have effective communication. We walk into offices and we ask them to identify what they see as being the problem. And there can be things that are unique from one office to the next that maybe are the result of certain personalities, and you won't hear them repeated at the next office because the personalities are different. But the one thing I can say, and I've heard it in every office that identifies itself as underachieving, is they feel there is a lack of communication. The team does not know what the doctors expect of them. The team does not know what their other teammates expect of them. It gets to the point where they don't even know what they expect of themselves, because they just don't know what's going on. There's no collective mission that's ever been communicated throughout the team. If you want to have effective patient communication, you have to make sure that it's consistent across your team. Because I can tell you, and I've seen it happen, where it seems like somebody has done a great job. The doctor has got case acceptance wrapped up, and somehow it gets undermined by a team member, always with good intentions, but they just answered a question in a way that wasn't consistent with how the team would like to approach the practice of dentistry in that office. And we use these meetings to try to solve those problems. That's the key. I've talked to, one of the most interesting opportunities is to talk to a team member at one of these underperforming teams who had the opportunity previously at working at a team that was doing a bang up job. Everyone was rocking it. And what they will often say is, we don't have meetings here. My old office that, we just didn't have any open time. We had regular meetings, and they were good meetings. And when we had problems, we were able to get together and figure out a solution because we had great meetings there. That never happens here. So any of the problems that we have persist. So yes, you can have team members look forward to your meetings because you make them effective. Now, what is the key to making them effective? The timing in this sense couldn't be better, as here we are in late November. We're wrapping up 2020, which of course could not come soon enough. If ever there was a year we wanted to turn the calendar on, it is this year. So we're looking ahead to 2021. And if you want to make sure that you are going to have effective team meetings, the first step that you need to do is to go to your calendar for next year and book every major team meeting you will hold. That means you need to decide, first of all, how often are you going to have your meetings? Some teams like to, I know some teams that like to have their major meetings every week. And maybe sometimes that's actually necessary because the team has a lot of issues that they have to solve and they want to start off every week to get things going. And maybe as they improve, they can reduce the frequency of their meetings to every 2 weeks, every month, whatever it is you think is going to be appropriate for your practice. You have to pick out that time now and book it. Schedule the time. If it's going to be monthly and you decide it's the first Wednesday of every month, book that time now. No one can ever then have the excuse that when it's coming up to a meeting day that, oh, I can't make the meeting, I've got something else booked that day. That's not going to be acceptable. That's a valid excuse if you're telling them the day before and they're going, sorry, something not working in my schedule. But when you booked it a year in advance and a team member is consistently saying they can't make it, that might be a sign that that's not an ideal team member for you. Now, in fairness, life can get in the way. Things can happen in the lives of some of the people that you work with where we have to kind of go, that is a valid reason for missing this meeting. You've got something really urgent going on. But as a general rule, when everybody knows the date and the time of every meeting for the whole year, piece of cake, they should be there. That should be blocked off. There's really no excuse for them not being able to make it. So book it. Now, here's the thing. You could be really humming along at such a great pace. The meetings have been super effective. Your team is really operating at a pretty high degree of efficiency. You get to within a couple of days of a meeting and you decide, you know, maybe we don't need a meeting this week. Maybe we can put it off to the next one 2 weeks from now. Odds are pretty good. If you need to be able to find some other things to do at that time, if that means that opens up some time to treat patients, you'll be able to fill that time. A good team will have been able to identify those patients it wants to put onto a short notice list and bring them in at a time when all of a sudden they find, hey, guess what? Things have opened up in our schedule. But it's a lot easier to cancel a scheduled meeting than it is to try at the last minute to cram one in on people. So make it a regular thing. Book it now for the year. And then as we get close to the end of 2021 and we're starting to turn our calendars towards 2022, you do the same thing. Repeat that process. It becomes predictable. Everybody knows the meeting is coming. This next recommendation is one that strikes terror into the hearts of a lot of the dentists who are underperforming when I tell them to schedule 2 hours. And the reason is pretty simple. They just want to make sure that they can confine the meeting to lunch hour from 12 till 1. They're not seeing any patients for that point in time, so there's no loss of productive time, no downtime. Why not cram that meeting into that 1 hour time slot? Now, here's the trick. Those offices that are performing at peak efficiency, they get it. They schedule 2 hour meetings because they know, yeah, I'm going to give up an hour of production on the day of that meeting. And if I have 5 clinical producers in my office, that might mean I'm giving up 5 hours of production for that particular day because of the meeting. But guess what? We are solving problems in our office to make sure that everything is running as efficiently as possible, and we don't have a lot of open time. If I can use that 1 extra hour into otherwise productive time with a patient to sit down with the team and develop solutions as to why we might be underperforming and why we have 15 hours of open time over the next week or two, I'm coming out way ahead because I've subtracted 5 hours of production, but added 15. So use that time, consider it an investment, schedule 2 hours. That is what you are going to need to take for an effective team meeting. It gives your team time to do all the things they need to do. For instance, they have to dismiss their patients. Here's the thing, these offices that are trying to cram this 1 hour meeting in, they're going to start the meeting at 12 o'clock, they're going to end it at 1 o'clock, but they're seeing patients till 12 o'clock. Now, I'm a pretty fast mover, but I don't think I can finish seeing a patient at 12 o'clock and get to a meeting that starts at 12 o'clock. I don't think I can move that fast. I'm going to need time to dismiss my patient and dismiss them properly. Okay, I'm then going to need time to clean up the operatory. I don't want to leave all these dirty instruments lying around because I'm racing to a meeting. I want to get them out of the operatory, get them in to be sterilized. I want to make sure that my operatory is wiped down. I want to make sure that I get washed up, that I get out of my gowns and everything, and that I'm clean and ready to go, because I don't want to just go in and eat my lunch now after I've been treating patients all day. I want to wash up. Okay. Then I want to be able to get there. I want to have time to eat my lunch. Now, if we think we're going to be able to cram an effective meeting into that 1 hour time slot by starting at 12 o'clock, knowing that we're treating patients right until 12 o'clock, think about it. Yeah, a few of our team members are going to be able to get there early. Maybe their patients didn't show up or they were ahead of schedule or something like that. And they're going to be there in plenty of time. But others, I mean, if they're going to go through this whole process, they're not showing up to that meeting till 12:10, maybe 12:15. So you now have a choice. You can either wait for all those team members to be there before you start the meeting, in which case you've now reduced your meeting time by 15 minutes, or you can start the meeting without them, which effectively tells them attendance at the meeting in a timely manner really isn't that important. And I guess the information we're going to cover can't be all that valuable either because we started without you. We don't want that to happen. We want to make sure that they can get there, that they can be ready to meet, that they can have an opportunity to eat their lunch and then be ready to go. That means the meeting, though we block off from 12 to 2, isn't actually going to start till 12:30. Now, maybe we're going a little bit ahead of schedule some days. Maybe we can look at it and say, wow, everyone's finished their lunch and is ready to go. Can we start at 12:20? Great. But as a general rule, let's say 12:30. That is going to give anyone who might be a little bit behind an opportunity to get there, to get cleaned up, dismiss their patients, get their lunch, eat their lunch, and then have pen and notepad ready to go for the meeting. Because if you're holding the meeting while they're eating, you don't have their undivided attention. They are not getting the full value out of what's happening, and they are not able to contribute because their attention is divided. All right. And that brings us to the next aspect, that idea that we are going to meet until 1 o'clock in that 1 hour time slot, but we have patients at 1 o'clock. So what do you think is going to start happening? Somewhere around 12:45, 12:50. Those people are starting to think about who is it that's coming in at 1 o'clock? Who are they going to have in their operatory? What is it what I saw in their patient file, their patient records that I want to be able to address? Their mind is thinking about things that have absolutely nothing to do with the meeting. You've lost their attention. The meeting is no longer effective to them. They're planning. And if you think you're going to be able to keep them there that whole time so that at 1 o'clock you dismiss them and you've made their afternoon start late now because of that, you're going to have a less than happy bunch. These people don't want to start their first patient in the afternoon behind schedule already. And you know what? The patient probably doesn't want to be running 10 minutes or so late either. So you want to make sure that you schedule things so that the meeting will end at about 12:45, 1:45, because we're doing 2 hours. So at 1:45, that's when you start wrapping things up. That gives everybody time to be able to clean up the lunchroom, throw out any garbage, maybe get things kind of reorganized. They can go wash up, brush their teeth. Remember, we're a dental office. If we've just had something garlicky for lunch, we don't want to be going in to see our next patient, breathing garlic on them because we were too rushed to brush our teeth. So they get that chance to be fully prepared to go and meet that patient properly. You've given yourself anywhere from an hour and 15 to an hour and 20 minutes to operate an effective meeting. That's what it takes. That is what it takes. And it strikes terror into the hearts of so many dentists. But when they invest that time and operate an effective meeting that solves some of the problems that they are having, they will see that that 1 hour is truly an investment. It is not wasted time. It is not lost production. It is an investment in improved overall team performance, improved overall patient care. And you know what? It doesn't hurt that when you also fill up more of your time, you get to make a little bit more money too. The next step in making sure that we have that effective team meeting is that we have to have an agenda. I've seen too many times where people are having a staff meeting and everyone shows up and it's like, what are we talking about? Nobody knows, nobody's prepared, nobody really knows what to say. The topics come as a complete surprise to them. That is not going to be effective, because if they know in advance what's coming, they can think about things. They can identify, yeah, that is an issue. They're not being called upon just like that to come up with, oh yeah, do I have a problem with that? Yeah, what was it I want? No, they've had time to think about it. So make sure that they get an agenda delivered to them in advance, however you choose to deliver it. Some teams are old-fashioned, they still print it out on paper, maybe just post it in a lunchroom. Some may deliver it on paper to everyone's workstation. Others just will email out the agenda for everyone so that they can open it and see in advance. Whatever works for your team. Every team has its own personality on that front. Pick what works for you. Just make sure you get that agenda out to them so that they know what is going to be discussed. Now, I guess taking it a little bit of a step back before you put that agenda together is to make sure that the team members have an opportunity to propose items to appear on a meeting agenda, because the team wants to be engaged. They don't want to just feel like every time they go into a meeting, it's you or the office manager dictating to them. They want to be able to say, you know, doctor, office manager, team, these are issues that I'm seeing. So you want to make sure that there's an opportunity for them to put forward items that you can include onto your agenda. So that's absolutely vital. They have to have it in by a certain deadline, okay? Because you've got to get that agenda out to them. So maybe you say, okay, if we have our meetings on Wednesdays, then by Monday afternoon at 1 o'clock, I need to have any items that you want to have on the agenda. If I don't get anything from you by then, don't send it to me, because it's not going to show up. And bear in mind, whether it's you or you delegate the responsibility to chair the meeting to your office manager, you may not necessarily be able to fit every item onto the agenda. You could have a week where team members have just thrown everything at you, and you look at it and say, whoa, this isn't going to work. We're going to have to pare things down. So people are going to have to understand, and you may have to explain to them, look, we didn't mean to ignore your issue. It's just that we had so many other things I feel that were a bit more important for this week that we have to cover. I will put that on the agenda for a future meeting. Be open and transparent about that. Let everybody know that you just couldn't fit everything in. But do your best to make sure that they have an opportunity so they feel, you know what, this is a team that listens to them. This is an environment where they have input into what goes on in the work life for them. The next step, allocating time per issue. See, too often what winds up happening is people put together an agenda and it's like a laundry list of everything. We're going grocery shopping, we've got everything on here, and 10, 15 items to be covered in that 2-hour time slot. Can't be done. Can't be done. Yeah, but you don't really know how much time you should be allocating for everything, or how you were going to be able to go through things. You just sort of sit there and think, okay, if I've got 10 issues, I'll just start and see how far we get. But that creates a perception that the meeting wasn't very effective, because you don't get to everything that's on the agenda. And even if the meeting wound up doing a good job at the items you covered, you're still going to look at it and think, covered 4 items out of 10. Boy, our meetings aren't very good. So think about how much time you need for every item and put that in the agenda as well. Make sure that that's included. You would be surprised at what a great self-regulating tool that is if you stick to it. Okay, maybe when it's a new part of the process, it's going to take a little bit of time. You'll be looking at it, you'll say you've got a particular item you've given 10 minutes to, and at 8 minutes in, you've got a team member that's still going on and talking about something, and you then as the chair speak up and say, just to let you know, we have 2 more minutes left on this particular item. And they kind of look at that and go, oh, you were serious about 10 minutes. When people know that that's going to be the standard that they have to adhere to, there's a remarkable ability for them to self-regulate. A lot of times people will talk because they like to hear themselves talk. And somebody will make a point, and then the next person will speak up, and all they've done is just said the same point, but changed the wording. And then maybe even a third person will speak in and say, yeah, I agree, but they're not adding any value. When they know that there is a time limit for every topic before we have to try to find a way to resolve that issue, when they've heard someone else raise the same issues that they have, they probably just look at it and say, okay, I don't need to speak. We've already addressed that particular issue. People understand that, and they will learn how to conduct themselves accordingly. So make sure that you set out a time limit. Now, you do have to have some flexibility. There can legitimately be times when you are having a discussion where it's taking on a bigger life than you thought it was going to. And so you'll look as you're getting at that 8-minute mark on the 10-minute issue, and you'll say, we're at 8 minutes right now, but we really seem to be having a good discussion. And this is an issue that I'm thinking is important to everybody. With your permission, key phrase, with your permission, I would like to propose that we continue the discussion on this topic, and we will drop whatever other topic from the agenda today and add it the next time. Odds are, if people are engaged in that particular part of the meeting, they will be fine with that. You don't want that to be the rule. You want that to be the exception. You want to, for the most part, be able to schedule and allocate time effectively and cover every item that you have in your agenda in the time that you've allotted. But some flexibility, just to be realistic, is also important. The way I like to start my meetings, if I can, if my team is small enough to be able to pull this off, and this is something that became really, really important during this whole COVID crisis. You begin with sort of what I call a 2-minute check-in. So you've allocated a couple of minutes of the meeting to just say, is everyone okay? Now, if it's a small team meeting, you may do it as a roundtable. If you've got a really big team, that might not work. You may just be able to have time to say, how's everybody doing? Maybe the person who's chairing asks a couple of people how they're doing, shares what they're doing. The key to it is, and what we learned from COVID as a big factor, is people were stressed. People had a lot of anxiety, especially early in the pandemic when we knew so little about what was going on. This was all brand new to us. And I think we're still stressed, but we're at least more adapted to it. Then it was just, we were all in shock. We didn't really know what to do. And the teams that functioned well were those that managed to get things going with Zoom or whatever other platform they used, and having team meetings to communicate with each other on a regular basis like that. Those are the teams that bounced back when they were able to reopen, and their production has been the highest because they maintained that team communication. But they would always start their meetings just kind of going around. How's everyone doing? You give permission to people to celebrate something great that happened, because we all love to celebrate the success of our team members. Sometimes you give them permission to say, I'm going through a tough time right now, and this is why. And if I'm not functioning at that 10 that I usually like to be, maybe I'm only at about a 5, we can understand that. And we can adapt what we do maybe to find ways to support that team member, get them maybe even up to a 7. That is a vital part, because it lets the team know that, we are about each other. We're about the people. You are my dental family. You matter to me. So how are you doing? After you do that check-in, you want to go over any of the outstanding or follow-up items that you've had from previous meetings to make sure that those items are being addressed. Again, allocating time, any updates, because sometimes you may have projects that are going to take a period of time over which you cannot just cover in one meeting. So it might be a quick update on the progress with a particular item, whatever. That, who knows what it's going to be, because we can't know just as we're talking hypothetically. But you make sure that you're following up, because the idea behind the meetings is to come up with solutions as to why we may not be performing as well as we could be. And that means we have to try to not only come up with our solutions, but make sure they're working. Make sure that we are getting ourselves on track. So we want to follow up on some of those items. Then we get into the new items of the day. That's how we put together an effective agenda for a meeting. It is absolutely vital. Like I said, it is not a laundry list. It is absolutely vital that these be prepared in advance so that team members can show up and be ready to contribute. Now, we touched upon one particular aspect there when I talked about action items. Remember, meetings we love our team. We love being together. We love working together, but we don't have meetings just because we want to be together. We have meetings because we have issues we want to address. When we have those issues, we don't want to just address them and leave them unresolved. We want to come up with solutions. That means we want to arrive at some sort of an action item as we've gone through and discussed the matter. Maybe we're having some sort of an issue, our patient communication software, somehow the way that we're using it isn't working effectively. I don't know if it's the messages we're sending out, if it's somehow it's not giving us the right analytics, but we're winding up with not being able to get our patients confirmed in a large enough number. We show up at a day, we have all these unconfirmed patients, too many of them are no-shows. This is what we've identified as being the problem. So what are we going to do to address it? And we'll have this meeting and we'll be discussing and we'll get to the end of it and we'll start along our way in terms of developing a solution, but we may not have the full solution developed at that meeting. Maybe we'll come through it and we'll say, you know what? I think what we need is a revision of the script that we use on that communication software, a revision in the way we try to use the software to get information out. So maybe we have to look at a new policy and procedure as to how we're going to do that. You know, Abbas, you're the one that raised this issue. Can I leave this one with you? I'd like you to put together a new script for us and a draft of a policy that we can implement and have that available for us for the next meeting. Are you good with that, Abbas? Now, Abbas is going to fall off his chair because I've just assigned him extra work and he's not overly thrilled about that. But actually then after he gets over that shock, he's going to go, yeah, I can do that. I did identify that as being an issue. And that is something that's important. And I want to make sure that gets addressed. So absolutely, I will be more than happy to take that on. And I will say, great, Abbas, thank you very much. Now we have to set a deadline. I know we have our next meeting in 2 weeks, but it really shouldn't take 2 weeks for this. Can we schedule time now, a week from today, where you can come into my office for 15 minutes and we'll discuss your progress? And then we can identify if there's any problems, if there's any additional procedures that need to be done. I've given Abbas a task. I've given Abbas a deadline. He's going to come to me in a week. We've scheduled that into both of our schedules. So I've not just left something hanging out there in the air saying, we need a new policy. Let's just hope it shows up somehow. Because it's not going to magically appear. I have assigned responsibility to that to Abbas. And I've given him a deadline, which, you know, if something happens and Abbas comes to me and this is going to be something I'm going to communicate to him as well. Abbas, about a day or two before that, if you find that you're struggling with this, can you come and let me know so that we don't go into the day of that meeting with me expecting something from you and you telling me you don't have anything? Because let me know so that I can perhaps be of assistance to help move the process along. Again, you make that part of the routine. Abbas is going to know that's the expectation. He'll live up to that. He'll live up to that because I'm going to check with them too a couple of days beforehand until everybody gets used to this is how we do things. All right. So have an action item with a deadline. And that part is the follow-up. That meeting that we're scheduling in is to make sure we're following up on things because we can talk about things till we're blue in the face. It doesn't matter how much planning we do, how much we think we're doing in the way of implementation, how much we think we're doing to move our agenda forward. We don't change anything if we don't follow up. We have to stop, take a moment, and actually see, is Abbas getting that work done? So that when I put that on the agenda for Abbas to present to the group in 2 weeks' time, because Abbas, you're going to have to talk at that then, okay? You drafted this for us, so you get to be the one to present it, okay? Deal? He knows that that's going to be his responsibility too. That's part of the follow-up process. I want to help and encourage and make sure that Abbas is going to be ready and give Abbas the credit for the good work that he will do in putting this all together. I'm not going to say that I did it. As the leader, that's not the way to do it. Abbas, 3 cheers to you. You did a great job at the end of the day when it's all done. Then we look at what's come at that meeting. Abbas presents something. Maybe that's it. Maybe we're done. Maybe we look at it and we say, okay, we have some more work to do on this. As a result of what we've identified in this new policy that we've come up with, well, we're doing something new. Maybe we've identified a new way that we need to use the software. Maybe some of our team members won't know how to do that. So we'll have to have some education and some training. Now, again, Abbas, because you came up with this, maybe you know that. And so I can and trust you to help train your team members so that they also know how to adhere to whatever new policy we've developed. Perhaps it's something where the training is a little bit more in depth and we actually want to go to the software provider and have one of their people provide us with the education and training. The key to it is, it's great if we've identified a problem. It's great if we've come up with a policy, but if we don't have the skills to actually then follow through and implement that policy, we've not accomplished anything. We haven't fully solved our problem. Okay, wonderful. Put that in the policy and procedures manual. I love that. I'm a big fan in having that. That's a wonderful way in the future for when you need to onboard new team members. They know what to expect. They know how you undertake certain tasks. That's the tool for your team to be able to use, but it's only good if people have the skills. And the beauty of this process is that it helps us to identify when the skills are lacking, and then we can take the necessary action. And there is absolutely no shame, none, in not having the skills at that time. Who knows why you don't? If the software is new to you, how can we expect you to just intuitively know it? If we want every member of the team to be using the software in the exact same way and not creating their own solution to a problem, so that we've got 5 different people doing the same thing 5 different ways, then we want to make sure that the training is provided so they understand this is how we do it. So we've gone through this process and we have identified, yay, we need training on this. We get the training. Are we done? Absolutely not. There is still more follow-up. We need to make sure that the training was effective, that people actually are doing what they've now been trained to do. So it may be a short action item at a future meeting where we'll get together and say, okay, as a result of all the work that Abbas did and the training that led to, I think we've had some time for everyone to be able to be brought up to speed. Does everyone know what's expected to be able to adhere to this new policy for using the ReCare system software? And people, of course, will all say yes, and we will say, okay, I need one of you to show me. Because people will always say yes. We need to make sure that they can demonstrate them. It's that old saying that I'm from Missouri, the show me state. You got to show me that you knew what I was talking about. So have somebody show you that they can actually take you through and learn what the new expectation is. And even then, there's still more follow-up. Great, we've done all of this. Has it made a difference? Do we have less unconfirmed appointments? Are we getting through to our patients and making sure that they are going to show up so that we reduce our open time? If the answer is yes, then that means we've effectively identified and solved the problem. If we're still having the same experience, then oops, we made a mistake, and that's okay. That's okay to make a mistake. Let's now reanalyze it and go through. But the key to it is we are following up, because again, the meeting is not just about talking. The meeting is to arrive at solutions. Meetings should be about having discussions that lead to decisions. We want to make sure that we are making the right decisions that improve our ability to communicate as a team, that improve our ability to deliver a consistent message across all team members and get that through to all of our patients. Because at the end of the day, it's all about making sure the patients are getting the care we know they need. If we're prescribing it, but they're not following through, there's a problem. We don't know for sure what the source of that problem is or where it lies, but we will uncover it through effective meetings that lead to decisions that help us reduce the number of those problems. And as we go about doing that and run these effective meetings, teams will know what's expected of them, and they will work consistently as a unit to making sure that your patients get the care that they deserve. And you know what? You all will be earning the money that you deserve. So with that, I think I'm actually a little bit ahead of schedule.